Go.
Yeah,
Hi, how are you doing?
I'm
I am
good. Welcome. I'm so
thank
glad
you.
you're here today. Yes.
Thank you.
So I've introduced you through social media to some of my peers and people that are on Facebook and Instagram, but they want to hear your voice. So why don't you tell them who you are?
Yeah, so I am Dr. Denise Hunter, MD, but I go by my rapper name too, which is Dr. D Nice Beaujolin. Beaujolin is my married name, so I
That
go
is,
by.
hey, that's not Haitian. He
It is
is,
Haitian. It is Haitian.
I love that.
Yeah, yeah. I just got married after medical school, and it didn't matter to either of us that I changed my name officially. So I am all for doing it, but I do call myself it.
Good.
So
I like it. Well, I like Dr. D Nice. Is that what your the youth that come see you and some of your other
yeah,
patients?
that's what people call me. I've called myself D Nice since you from the '80s, so you know the rapper D Nice.
Yes.
Since middle
What
school,
you
I've
trying to
called myself.
say? We're aging ourselves? No,
Huh?
I said we're aging ourselves now.
Hey, fine with that. I earned it last year.
What most people don't know is that we went to medical school together and graduated in 1999 from the University of Texas Medical Branch in Galveston. And I think a lot of our experiences started there. As you know, I have a new book coming up talking about the rules of medicine. And it's sort of like, that whole generation of us moving from old school medicine to new school medicine. And that's why I wanted to talk to you today about the state of medicine us addressing some things that are good and bad, and I think that you're on the good component side. So I want you to tell everybody sort of what you do.
Yeah, so the good component, what I would call, is just recognizing that um, we've had so many advancements in medicine, but yet still chronic diseases like high blood pressure, diabetes, coronary artery diseases, they're still so prevalent, so rampant, still ravaging our community, especially, and just families, destroying families and everything. And we still haven't gotten any better at curing them, preventing them. We just haven't. The numbers are showing that we're just not doing anything substantial to really change this. And so, what I've really attached myself to is this new wave coming up of lifestyle medicine, where we're really seeing some change in chronic diseases. You're able to even reverse certain chronic diseases by just lifestyle changes. These are things that we were not taught in medical school. That's the era. I mean, Sonia and I were talking before. I think just being lenient, maybe an hour, maybe an hour,
Maybe.
maybe an hour total in our education that we learned anything about nutrition. And all I could really remember is just the cardiac diet. And honestly, I couldn't really tell you what the cardiac diet was, but I learned it.
You're doing better than me because I
Yeah.
definitely don't remember it. Probably should.
I remember the 2 gram sodium diet too, because I just writing that as orders.
Right.
But I mean, you just didn't really get a lot of information on how to advise patients and how to live a good, healthy lifestyle.
And I believe that so many people in America, especially with looking for other ways, we've turned the corner where it's not just traditional medicine. And a lot of people have this belief that American medicine is traditional medicine, and actually it's Chinese medicine. Ayurvedic medicine is traditional medicine. But with that, we haven't learned, like what you're saying, lifestyle medicine. But you're also doing other training, like past your internal medicine degree. What other training are you're doing? Some other programs and this out there that can help other doctors.
Yeah, so there are quite a few options that are out there that may seem a little bit confusing, and quite honestly, I've dabbled in just about all of them. So I can go ahead and define a few of them with you. And I have a few notes, so if you see
Okay.
me looking on, I just want to make sure that I defined them well for you. So there's lifestyle medicine, which I actually got a board certification in. It wasn't a difficult certification. You do have to take some courses and you do have to actually sit an exam. And lifestyle medicine, basically, it just really approaches a patient looking at whole food, plant-based diet, physical activity, sleep, emotional well-being, and avoiding risky substances, and using those things to prevent and treat or even reverse a lot of lifestyle related illnesses, things like diabetes, high blood pressure, coronary artery disease, those kind of things. So that's lifestyle medicine. And then maybe your listeners too have heard of functional medicine, which is another one that you can get a board certification in. The courses are, the coursework is a little longer than lifestyle medicine, but it's still very satisfying because they do some of the same things, except for functional medicine, they really get into looking at cellular metabolism and digestive function and detoxification, and looking at things like oxidative stress. People are probably getting anxiety attacks now going back to their physiology courses.
Yeah,
but really,
I got a crick in my neck just thinking about it. Yes.
true. But I've done a little bit of the coursework already. And the first coursework, they broke out the Krebs cycle, girl.
Still around. That damn thing is not going away.
And I was like, oh, okay. I didn't know I needed that. But it's amazing how you can really begin to see how it interacts and it can affect chronic disease. And now, if you look at people talking about things like inflammation being the core cause of a lot of diseases. So it's to say, functional medicine really looks at those oxidative stress, and then they offer a solution based on lifestyle changes, and they also include some supplements. So you do learn how to prescribe supplements, herbal supplements with functional medicine.
Herbal supplements, don't pass that because you know people are going to ask. The big herbal supplement that is out there right now.
Which one? Tell me.
CBD and
yeah.
and all the derivatives of.
Yeah, I hadn't gotten deep into the course yet. I did the preliminary one. So I can't speak fully of what their stance is on it.
Okay, that's good. We'll leave it there.
But we cannot ignore that it does have some medicinal qualities. We cannot ignore that. I mean, if you think of medications that have been chemically reconstructed to mimic marijuana or CBD, like Marinol, where we use it for nausea patients and cancer patients. So you can't ignore that it does have some medicinal qualities. How that plays out, it's a bigger question for our discussion today.
We could do a whole discussion on that. And I think we do like a webinar of like 100 people, and we're all going to have a consensus of, maybe.
Good or bad, it is what it is. So that's functional medicine, lifestyle medicine. Then you also have integrative medicine. Mm-hmm. That's where it's still Western medicine, conventional medicine as we know it, but they incorporate things like acupuncture, massage. So it's the incorporation of the marrying of these two things to really treat the patient as a whole. So it's integrative medicine. And then there's another, there's mind-body medicine, where they really,
which is huge right now.
Where they really get into the relaxation and hypnosis and like Tai Chi and the spirituality of the human body, which you can't ignore too. We are all very spiritual beings, so you can't ignore that. And then most of us are probably familiar with preventive medicine. I know when we were in school, you could actually do a preventive medicine fellowship, which they concentrate more on like public health issues. So immunizations and screenings are the big emphasis in preventive medicine. So those are like a brief synopsis of that are out there.
I think I remember integrative and preventative, but definitely the mind body is huge right now. And I think it's really important. And if someone was to actually, a patient was actually to come, or how would they find or get, into that, or if they're looking for that alternative type of medicine, if you will.
That's typically there's a certain type of patient that goes after this thing. It really is that I moved from Denver, Colorado, which is tree hugger central. People were really aware of it. I had patients that saw me and they had another doctor, like a complementary medicine doctor, and you kind of accept it. And they'll bring you, oh, they said I have candida. Or, they say my adrenal glands are fatigued, and you kind of have to not like poo-poo on this because this is something that they genuinely believe. And
Right.
the truth of the matter is, I can't say it's not true. I can't say it's false because everything starts with an idea. I mean, there are times years ago where if you told somebody you were going to prescribe a prescription, they're like, "What? Huh? What?" So it all has to start there. So I had patients that actually were seeing different types of physicians, me included. I was just part of their care group. That was in Denver. Now I'm in rural North Carolina, where people are not as inclined to seek that type of medicine. So people aren't really searching for it.
Mm-hmm.
Typically, it's a Google search with functional medicine. It really is. Functional medicine, when you get your certification, you're logged in their website as a functional medicine provider, and people can search for you and find you.
Gotcha.
Or just word of mouth.
And I think that if people are now, like you say, Google search is huge. So we are moving towards the generation where we have the people that are a lot more inclined. You have the patient that's going to come in. I always say you have two types of patients, or sometimes three. You have the patient that comes in that is, whatever doc, whatever you say I need, and they're not inclined to ask questions, to be engaging. They will take the prescription and go.
Exactly.
And then you have the patient that basically is going to come in and be almost confrontational because they've been on one of those doctor sites that makes them think that they have their own MD, and without giving them any pub. And they walk in and they basically like, so I need X, Y, and Z, and I want you to write it. And it's like, so then what am I here for? That's so I'm just a liaison, if nothing else. And then you have the patients, which I enjoy, are the ones that actually come in and are open to listen, to engage and conversate with you and try to figure out what's best for them. And I think those are the patients that would be great for this complementary type of medicine of integrative lifestyle, mind, body. But people are searching for something. And so it's an educational thing. So that gets me off the track of talking about our education, which, you and I had this heart to heart the other day about. Sometimes I think we missed out on a lot, and really trying to take care of patients, me being a surgeon and you being more of the medical side, I cut, and I don't get into so much okay, so if you lose the 5 pounds, every 1 pound on you is 5 pounds on your knee. I can tell a patient that all day, but if I haven't given them physical therapy and anti-inflammatory medicines or the possibility of some type of complementary medicine that can help them do that, or do they have access to pool therapy or whatever else, I'm doing them a disservice because, you can't treat the whole person. And usually by the time they get to me, if it's a degenerative type of thing, it's almost too late, So it's like, how do we look at education now, considering they're talking about even shortening education for doctors and nurses, because the AMA basically said American Medical Association says by 2020, there's going to be a huge shortage of medical professionals out there. This is the state of a medicine right now. And if that's the case, and you're talking about shortening education, and here we are, old schools, what is going to happen to medicine?
These are all very good questions. I mean, looking ahead, I do feel we're going to have to be a little bit more creative in how we deliver health.
Yes.
The one-on-one patient model may not be, in my mind, just the one-on-one patient model, I don't find it to be as efficient for certain things. When you do want to, like, as far as you're thinking lifestyle things, when you want to educate, then the group model tends to fit it better. And that's where you're going to be able to utilize more of your oh Lord, what's the word I'm looking for? The other people in medicine, like your nurses and
Oh, the
social
the
workers and
ancillary or the
ancillary.
yeah.
That's the word. That
Mhm.
we can work more as a team, with the doctor taking the lead, and it can't just be it won't be able. The one-on-one model will not really do it when you think about the shortage that we're facing.
I think that's a great point, and that brings me to another point, which I've recently bought into a telemedicine company because I think telemedicine is definitely one of the answers to the future.
Yeah,
I see it as almost like, I left the ER yesterday and patients are there for colds and flu and that kind of stuff. And it's like, yeah, primary care doctors are not being utilized as much as ERs or whatever else. And I think that eventually medical companies and health insurances are going to say, you're going to have to go through our telehealth app or our telemedicine app before you can ever get a doctor's appointment, before you can ever get to an ER or whatever else. It's going to be a triage, if you will. Mhm.
yeah, it's
Some point.
you're they're gonna be a little bit more. Unfortunately, there are going to be a little bit more barriers before you actually get to a physician right there in front of you.
Right.
Uh, we
And
just
right now, for you, does it take a long time for patients to even get to you? I mean, this is an issue for patients that they're saying the state of medicine is I can't even get in to see someone.
yeah. So my situation is in a very rural clinic in North Carolina, Yanceyville. I mean, just the name alone, but it's a lovely clinic. I mean, just super well organized, super well run, and it's not as difficult for patients to get to me, I feel, but from the patient perspective, they feel it is.
Yeah.
Just because, I mean, I'm one person, limited appointments, and actually I work part-time. So patient access is is our access thing is a little different.
Mm-hmm.
Our access issue is not necessarily like the me personally as a physician. Our access issue is just access to care because we're so rural.
Gotcha.
Yeah,
But I think with telemedicine, that's going to help
exactly.
too.
That will end that.
But there's limitations. There's limitations there too, because then we get into the whole technology piece. Not everyone has access.
Yeah.
You know.
Well, you know what? It's you would think, but I'm country, one stoplight and everything, and everybody's got a cell phone. They all do. There's very few patients. The poorest of the poor I treat. I'm in a federally qualified health center,
Mm-hmm.
and everybody's got a cell phone.
Mm.
Will they have that cell phone next week? But
The follow-up appointment, right?
It's the truth. Their numbers change and switch so much, but overall, most people have access to cell phones.
Yeah. Well, and that's a good thing. So then telehealth would definitely be a possibility. With my company, Rodox, we basically are in several different states. So the issue now is if we go back to a government thing, the state of medicine, why is it that we can practice medicine in one state and practice medicine in another state, and medicine is the same, standard of care is the same, but I have to jump through all of these other hoops for regulation reasons for one state versus another state versus another state. And that's a huge limitation on physicians being able to maybe be in multiple places that could provide access and care, you know?
Exactly. That's something that still boggles me. Having just left one state to actually come back to a state that I did residency in, I had to do the whole credentialing thing all over again and applying for a license. To me, it should be a whole universal license. It's not like I have to take the boards for individual states.
Right.
So, you know what? I don't know the history of when that began and when that, or why. That's something that
we know this. It's a money thing. It's a money thing.
I can throw that out there. I don't know how conspiracy theorists you want to be.
We can go. We can go.
But you know, think of your viewers. I don't want y'all crazy, okay?
Oh goodness, I love it. But I think we have to be sometimes crazy to be still in medicine. And I think
It's,
as you and I have been friends forever, I think it's a passion that keeps people
yeah.
going.
Oh yeah.
But as being a wellness doctor, you know, a lot of physicians aren't well.
Oh gosh. Oh my goodness. No, it's awful. It's awful. I mean, it's I the only word I can think of is awful.
Mhm.
Where I was in Denver, we had actually I can think of three physicians that committed suicide
Mm,
that I knew. I mean, not closely, but I knew them. We've had conversations, and you didn't even know this was brewing inside their spirit.
right.
And but this is something that to be a caregiver is not easy. I mean, when you think you're sitting in that exam room and people are just unloading so much on you, I actually tell people I feel privileged to be invited into the deep places of people's lives like that.
Right. Yeah, I say the same thing. I said, I'm honored that you allow me to cut on you and
Yeah,
to hold your life in my hands while you're asleep, you know, like in your most vulnerable state. That's a huge trust. You know,
that
you
is.
want to make sure that person is mentally sane and
Yeah,
not manically depressed, as
yeah,
well as, you know, that's a bad place to be. And no one's really helping or addressing our, you know, burnout and our suicide rate in medical professionals.
exactly. When you just don't have it. I don't know. Some people it's difficult. It's just a really difficult. And if you
Mhm.
don't have a good system set in place on how to offload some of the things that are put on you, then it's tough. You end up in this, and then you have your other demands. You have your family, you have children, you have extended family, you have a life outside of medicine. So
Yeah.
all the pressures on you, and if you don't know how to properly take care of yourself,
Mhm.
then it's you end up with physician burnout, you end up with depression, you end up with a whole host of things
Yeah.
that it just makes the problem more complicated than it that hasn't been.
I love it. Hey, how are you, sir? So as we get ready to close, I want people to know, you know, what great work you're doing it and how you're doing it, and talk to us about, you know, the wellness side for teams and the whole wisdom piece and the fonts and all of that.
Yeah, so I am an internist, and I've been an internist for a long time. I have actually been a youth leader in my church since I myself was a youth, since I was about 16 or so. I think I had my first youth leader position. I was 18 years old and sitting on the church board as the youth leader. So it's been a long time. And what I've noted, the longer I was in internal medicine, the longer I realized that, oh my goodness, these diseases are preventable. This is even before I did lifestyle medicine. These things are preventable. And for me, I felt the best time to really start educating, really driving home the importance of wellness was starting with teenage years. That's the time you're more independent of your parents. You have a car, you can buy whatever food you want, you can go wherever you want to. So I really wanted to give um, this age group a good support, good decision making skills to take good care of their bodies. One of the So I developed a company called Wisdom Teethinger, and I'll explain the name for you in a little bit, but it's called Wisdom Teethinger, and I actually have a curriculum called Fount, which is the 5 keys to wellness and wisdom to help unlock your best. So Wisdom Teethinger is when you're a teen, your wisdom teeth, as well as the place in your brain that develops wisdom, are growing at the same time. It's not until you're about age 25 where your frontal lobe is fully developed. And it's about the same time that your wisdom teeth is developing too. And word on the street is, or urban legend or myth, is that that's why they called it wisdom teeth, because the same time those teeth are growing is the same time wisdom is developing, your frontal lobe. So I named my company after my target audience, which is that age group, Wisdom Teethinger.
I like
And now Fount is each letter, FOUNT, stands for something. The F is for fuel, which talks about how to feed and nourish your body with food. The O is for optimistic, talking about the mental aspect of living well and living your best life. And U is for understanding, which is understanding how your interaction with others, understanding how your body works, understanding how the world works around health, how that can help you. And then N is for natural, where just knowing that there's some natural remedies out there that you can use, as well as what things to avoid, toxins like, and smoking and alcohol and drugs, the usual. But there are other toxins to be avoided too. So I educate them on that. And then the last one, T, is for time, how to use your time well to achieve maximum wellness. And in that, in T, we talk about your sleep, hygiene. We talk about relaxing, because relaxing is important. And we also talk about exercise.
Nice.
In a nutshell. So I go around and teach young people the Fount curriculum. I gear it to depression in some presentations. I gear it specifically for young athletes, because athletes are putting a lot of demands on their bodies, and they don't really know how the basic care of it. They're relying on their youth, but I can show them how they can even supercharge their athletic performance by teaching them some principles of Fount that are perfect for athletes. And I also concentrate on weight loss. Fount works perfect for weight loss too. I myself was a chubby teen. And I actually lost 40 pounds my senior year in high school. And I have the experience of being a not so thin teenager. So I had the emotional things that went along with it too. So I really like to share that, as well as how Fount can help with weight loss forever and not get trapped in that diet trap.
Especially for that group, yeah. So how can people connect with you on your website and your social media handles?
So Wisdom Teethinger, if you search Wisdom Teethinger on Facebook, the Facebook page I have is Adults for Wisdom Teethinger. But if you put in Wisdom Teethinger, it'll pop up. It's a very unusual word. So it's Wisdom Teething Wisdom Teethinger. And on Instagram, I am on Wisdom Teethinger too. Every single day, Monday through Friday, I put up a health tip just for teens. I'm on Snapchat too. It's Wisdom Teething 1. Wisdom Teething was too long for Snapchat. So, so Wisdom Teething 1 on Snapchat and Wisdom Teething on Instagram. And I have a personal page that's linked to my Wisdom Teethinger page if you want to get to know me as a person.
Perfect.
But if you want health tips, Wisdom Teethinger is good for you.
I love it. Yeah. Well, I appreciate you, your time on a Sunday evening away from your family for a few minutes, just to share your experiences, your expertise on the state of medicine. Any words of wisdom before we go?
The latest thing on the street is sleep. Get your sleep. It's important. This is where your body fixes and repairs itself. You can't expect it to function the next day without proper sleep. As an adult, you do need 8 hours. If you're younger, you're teens, you need about 9 to 10 hours. And most of us are not getting enough sleep. When you don't sleep enough, less than 6 hours, your brain is operating the next day as if you're drunk, legally drunk. So get your sleep. It's important. And another thing, I'll throw this one out there. When you don't sleep, the next day, you tend to eat about 500 more calories more than you would have. There's a whole lot of things that happening with melatonin and different things that just messes you up and makes you want to eat more. So get some sleep.
I love it. I'm with that. I need that. Well, thank you so much again. And I appreciate the people that are watching as we talk about the state of medicine and where we're going in the future with medicine and the things that are existing, how we could possibly change them, and sometimes just for a place for medical professionals to gripe. Have a great night, everyone. Thank you.
Thank you for the invitation, Sonia.
No problem. You too. Good night.
All right. So that's it.